Welcome, my dear students. Myself, Dr. Saurabh Bhatia, Faculty of Pharmacology at dbmci, has brought you the most important topics of pharmacology for your upcoming exam, NEET PG 2023. So, let's start with the first topic, autonomic nervous system. So, guys, in autonomic nervous system, every year you get one MCQ from anti-glaucoma drug. So, this topic is also covered in ophthalmology as well as in pharmacology. So, you can be asked to mark the side effects of the anti-glaucoma drugs, can be asked to write about the drug of choice for this glaucoma treatment. Second is the cholinergic drugs. Now, cholinergic drug is a very easy topic for you guys. Like whenever you start autonomic nervous system, cholinergic drugs comes out to be a first topic. So guys, you people generally ignore these topics because you think this topic is very easy. But guys, let me tell you, you have to cover this topic in detail because every year they're asking questions in the detailed depth of this topic and cholinergic drugs. So cholinergic drug is the second most important topic. The third one is alpha blocker. Mostly they concentrate, or most of the time the questions are asked on the BPH. So alpha blockers, pheochromocytoma, BPH drugs are important for your exam. So for my opinion, in ANS, you should read these three topics before going for your exam. Second topic is respiratory system, and obviously in pharma, respiratory system has only one important topic, that is bronchial asthma drugs. So read the bronchial asthma drugs. But guys, for NEET PG exam, there are some new bronchial asthma drugs which has recently hit the market. So those are the monoclonal antibodies. So my suggestion is not to concentrate on those drugs because in NEET PG, generally they don't ask the monoclonal antibodies or the targeted therapies for bronchial asthma. So just concentrate on the basics of these bronchial asthma drugs. After this, the third topic is kidney. Now, kidney is a very dicey topic because here there are a lot of diuretics and like they can ask any question from any diuretic, but in the last 5 or 6 years, most of the questions have come from these three topics, that is carbonic anhydrase inhibitors, thiazides, and the medicines which act on antidiuretic hormone. Now guys, like whether you can correlate or not, in kidney there is a one new topic which has been added, that is SGLT2 inhibitors. So SGLT2 inhibitors like dapagliflozin, which is given for CHF. Now these things are important for this year exam. So in kidney, carbonic anhydrase inhibitor, thiazides, antidiuretic hormone drugs, as well as the SGLT2 inhibitors you should concentrate while going for your exam. Now after kidney, the next is cardiovascular system, and in cardiovascular system we have the evergreen topics like anti-hypertensive drugs. So being as a MBBS doctor, you must be knowing like you are expected to treat at least a hypertension. So anti-hypertensive drug is a very important topic. 2 MCQs are confirmed from this anti-hypertensive topic. The second is the CHF, because CHF is like, it's a kind of a cocktail of all the drugs which whatever we discuss in kidney, whatever we discuss in CVS, all drugs are given in the CHF treatment. So CHF drugs, very important topic. This year, I think the question will be on the ARNI treatment. So ARNI is a combination of valsartan plus the drug sacubitril. So this can be asked in detail. Its contraindication, its side effects, all these things can be asked related to the ARNI. Now after CHF, hematology. Now this topic is a very short topic but very important topic for your exam. Like every year you get minimum 2 MCQ from this exam. And no doubt the most important topics are antiplatelets, anticoagulants, and if you have time, you can read about the fibrinolytic medicines also. So antiplatelets, anticoagulants, as per me, most important topic in hematology. Now come to the CNS. Now this topic is like not the pharmacology topic. It's a combination of your anesthesia as well as neurology as well as the anesthesia part, right? So psychiatry, anesthesia, neurology, all will be there in the CNS. So this is very, very important topic in pharma. Minimum 4 to 5 MCQ you can expect, like in combination with other subjects. So anti-epileptics are important. Drug de-addiction, guys, nicotine de-addiction. Like there are many new things which are happening in this nicotine de-addiction. You should be knowing about nicotine de-addiction. Antipsychotic side effects, especially the extra-pyramidal side effects, are very important for your exam. SSRIs, SNRI. So although I have written only SSRIs, but this year SNRI and also the atypical antidepressants. So antidepressant as such is an important topic. So here the SSRIs, the most of the questions are asked in previous year, but this year they can ask you the SNRI also, as well as they can ask you the bupropion. So bupropion is the one which is having a lot of noise in the market regarding bupropion. So bupropion can be asked, as well as there is one group of medicines, we call them the serotonin modulators. Like vortioxetine is a drug that is there in that group. So serotonin modulators can be asked. Opioids, no doubt, evergreen topic. The questions definitely will be there from the anesthesia as well as from the pharma. Now after this CNS, the endocrine. Now endocrine topic coincide with the medicine. So anti-diabetics, 1 MCQ is confirmed. Thyroid drugs, most of the time question is asked on the carbimazole and the propylthiouracil. So the medicines which are thionomide, the main drugs of thyroid, the questions is asked on them. Second is the SCRM. So in SCRM, tamoxifen is very important topic, guys. So tamoxifen is important. Next is GnRH analogues. So the medicines which are given for prostate cancer, important to know. Medicines given for precocious puberty, important to know. And now this topic, aromatase enzyme inhibitors. So guys, recently they have started asking question on ovulation. You should be knowing all the drugs which are given for the treatment of infertility, especially the drugs which can cause ovulation in the females. So here the medicine name is letrozole, which is important for your exam. You should be knowing all details of the pharmacology of the letrozole. Antimicrobial topic. So this is the topic which you have to just mug up, where you have to mug up the drug of choice and everything about the bacteria. So antibiotic indications are important, right? So you must be knowing the drug of choice for all important bacterial infection, especially the syphilis as well as the pseudomonas and MRSA. All those infections are important. Antifungal, one MCQ is confirmed, will be covered in derma as well as covered in pharma. So antifungals are important. Now this year in antifungals, my suggestion is to read the treatment of candidiasis, Candida vulvovaginitis. So Candida vulvovaginitis is the important topic because there is a lot of noise on this topic. Lot of new things are coming up in this topic. So read that topic. Next is the HIV drugs, evergreen topic, because when there is no outbreak of the virus, they put question on HIV. So HIV is an important topic. TB and leprosy regimen, which is most of the time covered in your PSM as well as considered with the pharma. Every year you get one MCQ, and malaria treatment is also can be asked in the exam. Now after this CNS, we have come to the small topics like GIT. So in GIT, antiemetics, the drugs which are given for chemotherapy induced nausea vomiting are important, especially the aprepitant, ondansetron, those group of medicines. As well as there is a drug metoclopramide. So metoclopramide is asked around 2 or 3 times in your last 5-year exam. So read about metoclopramide. GERD drugs, the drugs which can increase the kinesis of the GIT. So prokinetics we call them, are important to know about this NEET PG. Autocoids, this is comparatively less important topic. One MCQ we are expecting from this topic, autocoids. The 3 things which I have asked in the recent 5 years exams is prostaglandin analogues, ergot derivatives, especially the side effects of ergot derivative, guys. Last year there were 2 questions on the ergot derivative side effects, so please be careful. Ergot derivatives can be asked. Dmards mein methotrexate is important to know, as well as we have the drugs like TNF alpha blocker. We have the medicines like baricitinib, tofacitinib. These medicines are the Janus kinase inhibitor, are important to know. Now after that, this autocoid topic, general pharma. Now general pharma is a topic where the drugs can be, the questions mainly asked on the DRC. So dose response curve is important. The second is the drug discovery, how a new drug is discovered. So various rules and regulations, what are the various sequence of the drug discovery, that is important. Dose response curve will be asked. And sorry for the spelling mistake. The third topic is whenever there is a deviation in the in the drug labels. So deviations of the drug label can be asked in the exam, right? So deviation of the drug label as well as the drug discovery. Third is the dose response curve. 3 things are important in general pharma. Now these are the topics which are mostly asked in NEET PG. Now one topic which is less commonly asked in NEET PG, so like if you are going for the exam, you can skip this topic, or if you want to read, if you have time, these are the 4 things which you can read in anti-cancer drugs. So cancer immunotherapy is gaining the importance. You must be knowing in your INACT they have asked the pembrolizumab. So cancer immunotherapy is important to know. Methotrexate, cisplatin are evergreen drugs. Questions are mostly asked on these 2 medicines, as well as the side effects of anti-cancer drugs are important topics. So these are the important topics which I have told you. So please guys, before going for the exam, please read these topics, because I assure you the questions will be asked from these topics only. Right? So thanks you for watching this video, and if you like this kind of videos, please keep on making these videos for you. I'll also cover the topics of pharma in short for 1 by 1 for you people. Please join us for the link which is given in this description. Thanks for watching this video, and all the very best for your exam.